This is a virtual baby shower done by the University of Maryland nursing students where we will provide education for new and/or expecting parents. We will be covering topics on prenatal care, nutrition during pregnancy, baby-proofing, breastfeeding, basic child care, shaken baby syndrome, safe sleep, and swaddling.
Please pause the video now and take our pre-quiz. If you go back to your email and press on the link underneath the word pre-quiz, it'll take you to our SurveyMonkey pre-quiz. At the end of the pre-quiz, it has a sign-in sheet where you can put your name and email address.
Prenatal care. Having a healthy pregnancy is one of the best ways to promote a healthy birth. Getting early and regular prenatal care improves the chances of a healthy pregnancy. This care can begin even before pregnancy with a pre-pregnancy care visit to a healthcare provider. Develop a plan for reproductive life. Increase daily intake of folic acid to at least 400 milligrams a day, either through vitamins or added through diet. Immunizations should be up to date so the mother can pass antibodies to their baby. Control other medical conditions like diabetes, high blood pressure, and high cholesterol. Avoid smoking, alcohol, and other drugs. Try your best to attain a healthy weight. Seek help for depression, anxiety, or any other mental health issues. Don't be afraid to ask questions. Your provider is there to help you. Nutrition during pregnancy. The first trimester does not require any extra calories, but eating for 2 only requires an additional 340 calories during the second trimester and 500 in the third. Try to choose foods and beverages that are nutrient dense. This means that they are good sources of the building blocks your body needs. Nutrient-dense foods are full of vitamins, minerals, and other nutrients. Eat a variety of foods from all 5 groups. These include grains, vegetables, fruits, dairy, meat, and beans. This will ensure that you and your growing baby are getting all the nutrients that you both need. Try to focus on protein, carbohydrates, healthy fats, calcium, vitamin D, iron, and folic acid. If you can, try to avoid caffeine, low-calorie sweeteners, sodium, and alcohol. Appropriate weight gain during pregnancy ranges from individual to individual based off of prior weight. If you're average weight, you only have to gain 25 to 35 pounds during pregnancy. Underweight, 28 to 40, and overweight women may only need to gain 15 to 25 pounds.
When expecting a newborn child, it is extremely important to baby-proof your home. Did you know that more than 1/3 of child injuries happen at home? According to the CDC, most accidents happen in 4 high-risk zones. They are water, heat or flame, toxic substance, and potential for falls. I'll go over them in detail to help you prepare. Regarding water, you want to look at pools, bathtubs, your kitchen, laundry. It's very important to place your hot water heater temperature at a safe level. It should be no hotter than 120 degrees to avoid accidental burning. Make sure to put no slip strips on the bottom of your tub. Or if your baby is newborn and you have access to an infant tub, you should use that as well. And no matter what age, never leave a child alone in the water. For pools and hot tubs, even if you don't have one at your own home, but you're going to visit a friend who does, make sure that they have at least a 4-foot fence with a self-latching gate around their pool. Pool covers and alarms also help. It's important to ask your friends when visiting if they have these things in their home. With regards to heat or flame, you have the kitchen, grills, electrical outlets, and fireplaces all to consider. Especially when it comes to stoves, use a stove guard and latch covers to prevent babies or toddlers from turning the burners on. Practice using the back burners while your infant is young when you're cooking, just to avoid the reach over the top so they don't burn their hands. Make sure your fireplace has a cover on the front and that you use bumpers in the front to stop the baby from hurting themselves if they fall near any sharp corners. Toxic substances would be considered your medicine cabinets, cleaning supplies under your sink, your garage, and it's really important with those items that you keep those up and away, but that you also use cabinet locks and drawer locks for those. It's not enough to just keep those items up and away from children. You need to use locks to keep them safe. The areas that are potential for falls would be stairs, unanchored furniture, slippery floors, or even high windows. It's important to use baby gates and anchor your furniture. Please don't put a TV on top of a high dresser, as those dresser drawers may later be used for climbing. So it's very important to consider all these things when your babies are young. You might ask yourself, when is the best time to start baby-proofing your home? Many people believe it's once your baby becomes mobile. However, that is false. It is never too early to start baby-proofing. Start now. Once your new infant joins the family, you won't have time to consider these things, and it's best if these are all done in advance to keep everyone safe. Some ideas for baby-proofing include safety latches and locks, as I mentioned before, outlet covers. You definitely want to do that to prevent electrocution. Furniture anchors, as mentioned. Corner and edge bumpers for all sharp objects in the home, meaning a coffee table, your fireplace, kitchen counters. Those are all places where children could fall and bump and cut themselves. You also want to use knob covers for the oven, also for doors, so babies can't escape the home and you wouldn't know. It's important to use cordless window coverings or protect your blinds. If you have cords hanging down from your blinds, that you tie them up high and away. It's important every home have a carbon monoxide and smoke detector. You also would want to learn CPR and call 911 in case of any emergencies. Another very important resource for you would be poison control. Did you know that poison control is ready to assist 24/7? They have trained pharmacists and nurses on hand that answer your calls directly and can help you with anything from spider bites to accidental ingestions and chemical exposures. It's a great resource and should be used. And the number is 1-800-222-1212. So don't forget, baby-proof your home now and then reassess your baby-proofing as the baby starts getting older and hits different milestones. Here's a picture of a successful baby-proof living room. You'll notice that there's a carbon monoxide and smoke detectors on every floor. Make it a habit to check your batteries on a monthly basis to make sure they're working. Anchor your TVs to the wall and hide your electrical cords. Move tall, wobbly lamps behind furniture, or maybe don't use that type of lamp at all. Install fireplace screens around the hearth. Place a rug down on slippery floors, especially once your baby starts walking. Remove blinds with looped cords to avoid strangulation. Place safety covers over electrical outlets. And don't forget to put the baby gates at the top and bottom of the stairs. If you successfully do this, you will have a safe environment for your baby to grow and thrive.
Some quick facts about breastfeeding. Infants who are breastfed have lower risk of asthma, obesity, type 1 diabetes, sudden infant death syndrome, ear infections, gastrointestinal infections, and respiratory disease. Breast milk also contains antibodies to help your baby fight against infection and has whey, which makes it easier to digest for baby. Moms that breastfeed also have a lower risk of developing breast cancer, postpartum depression, heart disease, and stroke. It is important to note that no cow's milk should be given to baby before they are 1 because babies are not fully able to digest cow's milk. Bulb suctioning makes it easier for baby to breathe and eat. Parents and/or guardians should only suction the baby 4 times a day before feedings if the baby is congested or has a stuffy nose. How to suction. Squeeze air out of the bulb and place the tip of the squeezed bulb into the nostril. Release the bulb to let air back in, and then squeeze the mucus out of the bulb onto a tissue. Repeat onto the other nostril. A diaper rash is inflamed skin on a baby's bottom. This can be from infrequently changed diapers, skin sensitivity and rubbing. Ways to prevent diaper rash is changing diapers often, rinsing baby's bottom with warm water, when changing the diaper, letting their bottom air dry, and using ointments. If it is infected, make sure to contact your pediatrician. Shaken baby syndrome is when a parent or caregiver shakes a baby out of anger or frustration. This is fatal because infants have poor neck strength, and it causes brain bruising, tearing of blood vessels and nerves, resulting in brain injury. If you are feeling angry, overwhelmed, or frustrated, try to take a deep breath, let the baby cry, get some alone time, and call someone for support.
Please pause your video now and watch this video made by the Be More for Healthy Babies on Safe Sleep. You can copy and paste the URL below into your search engine and the video will pop up. Safe sleep. It's important to know your ABCDs when it comes to safe sleep. As I'm sure you could have gathered from the video you just watched, there are 4 main themes when it comes to safe sleep. Your baby should sleep alone, on their back, in their crib, and don't smoke. When I say alone, I mean you can share a room, but just not a bed. Your babies are less likely to choke or suffocate when they are on their back. The crib should be clean, clear, sheets tight, nothing in there except for their swaddle, a sheet, and a mattress. And don't smoke. Any form of smoke can make it harder for your baby to breathe. Swaddling 101. Swaddling is a great tool to have in your parent toolkit, but it doesn't have to be used. I'm going to be talking about some do's and some don'ts and some benefits of swaddling today. On the right-hand side, I have an explanation of how to swaddle your baby, steps 1, 2, 3, 4, and I will tell you that practice makes perfect. You can always practice on a baby doll before you practice on your baby. So some do's to swaddling is you want to make sure that your swaddle is not too loose, not too tight, but just right. If your swaddle is too loose, then your baby can easily move around and get free and roll over and cause suffocation or roll off and into other things, which can be dangerous. If it's too tight, it can cause strangulation or suffocation if the blanket is too tight around their neck or chest, or if the blanket happens to go over their face. Even though your baby will look very soothed and happy in the swaddle, you still want to monitor them. Some don'ts to swaddling is if you choose to swaddle your baby, you want to make sure you're phasing out swaddling by 2 to 3 months, because after 2 to 3 months, your baby can start to develop hip problems. When your baby is swaddled, you want to make sure that there's nothing by their face, so the area that they're placed in the swaddle, you want to make sure it's nice and clear, no blankets, stuffed animals, toys, or anything. You want to make sure the swaddle itself is not covering their face. You also want to make sure that if you're swaddling your baby, there's no need to put a blanket over top of the swaddle, because this can cause them to overheat. Some benefits to swaddling your baby is it keeps your baby warm. It can soothe your baby because it mimics the position they were in the womb. Swaddling encourages safe sleep because when you swaddle your baby, they're supposed to be on their back, not on their side or on their belly. And that is the B in the ABCDs of safe sleep. And lastly, swaddling has been shown in research that it helps the baby sleep longer at night. Please pause the video now and go back to the email and click on the link where it says post quiz. This will redirect you to our post quiz survey monkey. Please take the post quiz, and at the end of the post quiz, there will be a place for you to sign out. On this resource page, I have safe sleep resources and swaddling resources for you. For the safe sleep resources, I have a safe parent helpline that's open 24 hours a day, as well as hotlines for treatment for substance use and mental health and help with quitting tobacco. I also have a call line for people if they need help paying their utility bills or if you need a portable crib for your baby. At the bottom, I have a video on swaddling. It shows you step by step how to swaddle your baby. I will encourage you to watch it a couple times, and definitely practice makes perfect. I hope these resources are helpful to you and your family.
These 3 websites are also great resources that deal with child proofing, the Poison Center, and CPR.
Here are our references for your review.